Hello, this is Dr. Pauline Lucas. Welcome back for session 5 of my series, Nurturing the Body, Mindfulness and Meditation for Physical Healing. Thank you for joining me today. Today I'd like to talk about acceptance. When I first introduced the idea of acceptance to my patients who are dealing with pain and physical limitations, their response is often one of disbelief or even irritation with me. Why would I accept my injury? I don't want to live my life like this. My situation is unacceptable. I want to be well. Before they want to leave the exam room, I explain that I'm not suggesting that they resign themselves passively to their fate from this moment forward, but that they consider experiencing and accepting their pain and limitations only for this moment. I also acknowledge that acceptance of pain and illness seems like a counterintuitive idea. We typically work hard on the opposite, pushing away negative feeling and experiences and trying to fight the pain. I explain that resisting our experience can create additional stress. I compare it to participating in a battle we can't win. Resisting what is takes a lot of energy, as we are trying to push away the pain or illness and the negative feelings and worries we have about it. I invite my patients to consider experiencing and accepting just this moment, including all symptoms, physical limitations, frustrations, grief, anger, and all other feelings, even their desires to feel better. And I ask you the same. Would you be willing to consider the idea of fully accepting yourself, including any discomfort, worries, fears, stresses, frustrations, desires, hopes, etc., just for this moment? Are you willing, just for this moment, to drop any resistance to your experience? Not looking ahead at the future, just this moment, accepting what is, without judgment and without stories, objectively noticing your experience of this moment. That is what is meant with the term mindfulness. Paying attention, on purpose, in the present moment, and non-judgmentally. And I like to add, doing so with an attitude of kindness and compassion to yourself, paying kind attention to this moment. You see, the fact is, we're not really in control of our healing. Of course, we should do everything we can to create the best possible healing environment. Getting enough rest, eating nourishing foods, following medical advice, taking medicine and supplements as prescribed, working with our physical therapist, practicing meditation, etc. But beyond that, we cannot fully control the outcome. By practicing mindful awareness and acceptance of the moment, we learn to calmly ride the waves of uncertainty instead of being tossed about them. This brings with it equanimity, which is a balanced state of mind that can find some sort of peace in any circumstance, even illness and pain. And when we have a calm and balanced mind, when we no longer put energy in resisting, we create a better healing environment in our body and have more energy available for healing. Today's meditation practice is called Mindfulness Meditation. I will be guiding you as we focus on our actual experiences, moment by moment, non-judgmentally, and with an attitude of kindness and compassion for ourselves. So go ahead and find yourself in a comfortable position, ideally sitting upright. But if it's too uncomfortable to sit, then please lie down in a comfortable position. The idea is that we do not let ourselves fall asleep, but that we stay alert. So once you are situated, go ahead and start with taking 3 long breaths, ideally in and out through your nose, allowing the belly to rise and expand on the in-breath and sink back down on the out-breath. Perhaps having the intention of letting go of expectations, letting go of unnecessary tension, and just transitioning from listening and paying attention to really tuning in with yourself. At the end of your 3rd breath, allow your breath to resume its natural pace. And if it's comfortable to do so, allow your eyes to close or cap your eyes, which means gazing down, the eyes half closed. Let's start by bringing our awareness to any sounds that are present in the room you're in, or sounds coming from outside your room, even sounds coming from your own body. Allowing the sounds to come to your ears without needing to figure out where they're coming from. Without the need to react to any sounds. Simply accepting any sounds that are present. And now let's bring the awareness to the body. I will be briefly guiding you through a body scan. We're going to start at the top of the head and make our way down to the feet. And what we're going to pay attention to is the actual sensations. Seeing if we can do this with a bit of a detached or objective mind. If we encounter areas of discomfort, we try to see if we can have an objective experience of this. Instead of telling ourselves, this is pain, I hate this feeling, can we objectively notice the different sensations that are present? Let's start at the top of the head. Bring the awareness to the top of the head, noticing any sensations present. Temperature, pressure, tingly, any sensations that are there, simply notice. Forehead. Notice if there's areas of tension, areas that are relaxed, areas of pressure, softness, cool or warm. And then bring the awareness to the eyes, the eyelids, eyebrows. What do you feel there? And then noticing the cheeks, jaw, tongue, and inside of the mouth. Feeling moisture. Notice if there's clenching or softness of the muscles. Feeling the lips. Are they touching? Or is there a little space between them? Feeling the ears. The back of the head. Back of the neck. Sides of the neck. And front of the neck. And notice, do you have a tendency of judging what you feel? Or can you simply notice the different sensations without any judgment? Noticing the shoulders. And the right arm all the way from shoulder to fingertips. Just mentally scanning the upper arm, the elbow, forearm, wrist, palm of the hand, back of the hand, and all fingers from thumb to pinky. And again, if you're encountering an area of discomfort, can you see what you're actually feeling objectively without any label? No good or bad, simply noticing sensations. And the left arm from shoulder to fingertips. Noticing the upper arm, temperature, sensations. Elbow, forearm, wrist, palm of the hand, back of the hand, and all fingers from thumb to pinky. Feel all the sensations present in your left arm with an attitude of kindness and no judgment. And then bringing awareness to the chest. You might feel sensation of heartbeat. You might feel expansion and contraction of the ribs with in-breath and out-breath. And notice any other sensations present. Allowing yourself to relax into the experience of the body scan. No need to focus hard or strain. Simply notice. And then noticing the belly, all the way from ribs to pubic area. And notice what sensations are present there. Temperature, possibly sensations of movement through your digestive system. Rising and falling of the belly as you're breathing. And sometimes we have some emotional experience or judgment around this part of our body. Simply notice. And relaxing into this experience. staying kind to yourself throughout it. And then moving our awareness to the upper back, shoulder blades. What are you feeling in this area? Are any sensations jumping out at you, more obvious than others? Perhaps you feel your clothing moving over your skin as you're breathing. If you're seated, even if you're lying down on your back, you might feel pressure from the surface you're resting against. And again, allow yourself to relax into this experience, not trying to make anything happen, simply really noticing what is happening, what is there. And then feeling your back, your lower back, all the way down to the backs of the hips. Mindfully scanning this area. And again, if you encounter an area of discomfort, see if you again can feel the sensations objectively, perhaps pressure or any other type of description for what you're feeling, without a story and without judging it as good or bad. And then feeling your right leg all the way from hip to tips of toes. Feeling the hip front, side and back. The thigh, front, sides and back. The knee, lower leg, and the right foot, the top of the foot, the heel, bottom of the foot, and all toes, from big toe to little toe. Just scanning the sensations, feeling the aliveness in your leg. And moving on to the left side, starting with the hip, front, side and back. And the thigh, front, sides and back. The left knee, the left lower leg, top of the foot, the heel, the bottom of the foot, and all 5 toes. Feeling all sensation from the top of the head to the tips of the toes, to the tips of the fingers. Feeling the body as a field of sensation. Can you fully allow yourself to relax into these sensations? Allowing yourself to rest into this moment. And then allow yourself to take another long breath in and a complete breath out. And notice your state of mind right now. Again, with an accepting attitude, notice any thoughts you might have. Notice the state of your body right now. Then I invite you to rub your hands together vigorously until they feel nice and warm. And then place your left hand over the center of your chest, your heart, followed by the right hand on top of the left. And allow the warmth of the hands to penetrate the chest. And when that feels complete, allow yourself to stretch a little bit, perhaps yawn, and then go about your day mindfully after taking just a few more moments to rest and ease back into your day. Thank you for meditating with me.